My name is Judith Ancer, and I'm a clinical psychologist based in Johannesburg. And today I'm going to be talking about sexuality, gender, and identity. And I'm going to start with an overview of how we can start thinking about these issues in a fact-based way, rather than in a way that's determined by culture, fear, belief, wish, fantasy. I'm going to look at some of the words because there are lots and lots of words, some of them are very strange indeed when we come to these issues, and look at the research and evidence that shapes the way I think about this topic. And then I'm going to look at the roles and responsibilities we have as mental health professionals in dealing with this topic. So my starting point is that there's an ethical and clinical imperative to deal with the issues of sexual and gender diversity in a way that's not about fear, prejudice, assumption, or fantasy. There are lots and lots of controversies and contestations in this area, and the debate about sexuality and gender is kind of mired in issues around religion, history, and in fact around abuse as well. We'll talk about that. My starting point really about anything is that it's important to understand and research the facts. I was very taken with the book by Hans Rosling, who was a Swedish epidemiologist and public health expert, who spoke about factfulness as a way of dealing with fear and anxiety about whatever is unknown. And what he also says is that if you look at the research and understand what's really happening in the world, you have a way of dealing with the world and with new topics that's about knowledge, understanding, an appropriate curiosity, and not simply about fear and about fantasy. So my point is that you can't choose your facts. And my approach to this highly contested area around sexual diversity and gender is to say that my basis for understanding is as a scientist and a psychotherapist, as a mental health professional, that my area is to look at the evidence and research that comes out of science, out of physiology, out of child development, and from neurology. The science itself isn't perfect, but it's the best starting off point that we have. My stance as a mental health professional is also that I'm an ally to people who are sexually and gender diverse. I, of course, can't speak to the experiences of every person who is sexually or gender diverse, but I hope to help my colleagues, the clients that we all see, and the families I work with to approach this topic in a way that's informed by compassion and reason. The pink triangle that was worn by homosexual prisoners in the concentration camps of the Holocaust is a reminder to us all that we have to be better and do better. It reminds us all of the horrifying history of oppression and abuse suffered by gender and sexually diverse people, and the fact that in large parts of the world still, LGBTQ people are vulnerable to violence, discrimination, and even for being criminalized and murdered for who they are. So in accordance with the South African Constitution, with our Bill of Rights, and our ethical guideline to act in accordance with the principles of beneficence, that is to do good, and non-maleficence, to not do harm, I want to reiterate the importance of something that we call an affirmative stance in addressing issues of sexual and gender diversity. An affirmative stance means we don't simply say we're neutral about this issue, but that we are working to affirm the dignity and human rights, which are in accordance with our Constitution, of all people, regardless of their sexual orientation or their gender identity. So we work as mental health